complete end block, 11124, initials EP. This is a 72-year-old patient who had implants from 1983. So she comes to me with a grade 4 contracture on the right. That is where the contracture literally squeezes the implant so hard, nice and tight, where the patient actually has pain as a direct result of that implant sitting directly on top of the chest. On the left, she had grade 3 contracture. When you have no pain and it is hard, like a hard ball, if you will, this is referred to as the grade 3 capsular contracture minus the pain on the left side. So as you can imagine, she is of age and she had this discomfort. She learned about the breast implant illness and the many symptoms of fatigue amongst the many others. And clearly, after having met the criteria for surgery, she got her clearance and now proceeded with surgery. So as you can see, here is the scar. I removed the excess skin as well, full thickness. This really helps with the uh, contouring. And as you can see, there's a lot of inflamed tissue on the side, very hard, and it actually showed some extravasation on the imaging that she had done. Now, this is how she essentially came to me. Now, knowing the fact that she has implants from 1983, she is ruptured till proven otherwise. So I'm going to go ahead and go in. I'm actually going to enter from this area. And as you can see, this is a lot of inflamed tissue. All of this tissue has to be removed. And by definition, this is ruptured till proven otherwise. And as you can see, this is hard, relatively small implants. And as I go in, look, the 72-year-old lady uh, was hurting, and you can only imagine how this implant was contained and sitting inside her, causing pain on the right side with the R. As you can see, I'm going to squeeze it out. All contained, none of this spilled into the chest. 1983, as you can imagine, this is the Ronald Reagan era. This is literally the pocket, as you will see, into which the implant was sitting. And as I cut, you will see very hard and calcified, but all of it is has been removed. Now, as you have seen many times in the past, there is this powder type consistency that forms. That's all as a direct result. So remember, silica dioxide, that's sand, and God only knows this needs to be analyzed in a mass spectroscopy slash industrial lab to see what it is. As you can see, this is hard powder stuff, like gypsum, if you will, and cement, and some of it is crusty. Look, I can snap it, and these are like very hard, like the scales of a fish, if you will. And if I go like this, you will see very hard. As you can imagine, they were impinging on a nerve in the proximity and causing the contracture. As you can see, I'm going to snap it. Let me use my, as you can see right here. So what I'm going to do is, let's go ahead and look at this very small implant, small lady too. And overall, if I go like this, you can see the slowly leaching of the silicone and the body in itself trying to protect it. Now what I'm going to do is I'm going to remove my top glove. This is the con procedure. You can focus on this. No lift. This is the grade 4 contracture, a lot of inflammation. No, this is not the time to be doing a lift. No drains. Certainly this patient has not gotten any drains, and the last time I put drains was well over 4 years ago. All the capsules go to pathology to rule out the BIA, which is the breast implant associated anaplastic large cell lymphoma, squamous cell cancer, breast cancer, anything abnormal. Cultures are sent for aerobic, anaerobic, and fungal to microbiology. The implants are always returned to the patient. And then the pictures and videos, high definition of the chest wall, and also cutting open of the capsule. In this case, it's a Facebook Live. This is all shared with the patient if the patient wants. The patient gets anesthesia, which is deep sedation, local plus sedation, and the patient to date, as you will see, have no recollection of the surgery. And all patients, regardless of age or comorbidities or problems that they have, they get the same surgery so that all of the capsular burden is removed. Now, I've removed my gloves. I have another set, and as you can see, this is the scar tissue, full thickness. And now, I hold this, you can see this tissue is inflamed and angry, and I want to remove as much of it as possible. Likewise over here. And so as I go in, let me go in from here. You will see this is not healthy tissue. Uh, it's very hard. As I cut with the scissor, you can see I'm having a hard time. And as I cut, especially at the dependent portion, when the silicone leaches inferiorly because it's very dense and can form these pockets, if you will, especially if there was a local extravasation, which inevitably does occur. Inevitably does occur. You can see, look at this tissue. This is not healthy tissue. If you look at this tissue, this yellow is good, healthy. I could have left that behind, but I wanted to bring it along, and because it was in the proximity of that tissue. So as I go in, you can see right here, is the entry point. You can actually hear me cutting through. I'm actually interested in cutting into this area, so you can see if there is any extravasation here. So you can see, look at this outpouching right here and this tissue that certainly needs to go. I'm going to flip my scissors around. And as I go in, you will see no implants are safe. Look, this lady at this age unfortunately had to go through a surgery. And as you can see, she's only better off. You can see over here, look at this, all contained. This was all in her body. You can imagine the silicon poison, the silicon toxicity that she's been living with. And this is all, look at this, hard, all contained. And if you look at these outpouchings, if you look over here, look at this outpouching. If I go invert it, you can see all the way it goes into that corner. So that's why it's important to remove all of these tissues, because they're inside pockets that form. Like right here, if I flip this around, it's in that pocket. So overall, this was very involved surgery. And again, the whole goal was to preserve it. And as you can see, disintegrated. Look at the color of the implant as well. It turns yellow. And so no implants are safe. Look at this. She has had this silicon poisoning going on for all these years. Unfortunately, there is no such thing as a safe implant. Last week, we did the gummy bear, supposed to be the safer implant. No, she was ruptured on the right side, took over 2 hours to do. And she was relatively young, nice lady from Texas, as we all saw on the last Facebook Live. So the implants are all bad, be it silicone or saline, and the whole purpose of the surgery is to remove the entire implant, capsule, all inflamed tissue, plus anything inflamed in the proximity, because this is where the silicone has leached into. And then it needs to be sent to pathology to make sure it's not lymphoma, squamous cell, or anything abnormal. And it needs to be done in a very pristine way such that there is no inflammatory burden left behind. So there you have it. This is Dr. Khan, Executive Plastic Surgery. Please wait.